If you or a loved one is living with Crohn's disease, you might be a good candidate for an investigational treatment study going on right here in Hampton Roads. Joining us now to tell us more is Dr. Frances Jones from TPMG Gastroenterology in Williamsburg. Dr. Jones, welcome to Hampton Road Show.
Hi, thank you for having me, Chris.
Dr. Jones, before we jump into the study, can you tell us all about Crohn's disease and what people should know?
Yes, Crohn's disease is an autoimmune disease where your body recognizes parts of your GI tract as foreign and attacks it, causing damage, ulcers, bleeding, diarrhea, abdominal pain. It can happen anywhere from the mouth all the way down to your colon, and it affects many Americans, can be quite debilitating.
Now let's go to the study. What are you trying to prove or disprove?
Well, this is actually a treatment trial for patients with moderate to severe Crohn's that haven't responded to other agents that we typically use. And so it's a fantastic study because while it does have a placebo trial, it's also looking at Stelara, which is already proved to be used in Crohn's disease, and the next generation, which is mirikizumab, so very similar to Stelara. What's nice about this study is these drugs are already on the market, already FDA approved, either for Crohn's or for other diseases, so it's not an unnamed drug. The other nice thing about it is even if you are in the placebo arm, after 12 weeks, you get randomized to drug. So everybody gets drug at some point.
What type of participants are you looking for? What should we know?
I'm looking for patients with Crohn's disease that have moderate to severe disease and have failed their current regimens.
And tell me more about the study and what they should know if they do sign up for it.
Yeah, for the study, if they are interested, we would get their records, see if they're a candidate. They'd have to go through some laboratory and endoscopic parameters to see if they're a candidate for the study. And then once enrolled, they would receive free drug, and we would follow them for a year. This study is compensated, so they do receive some monetary payment for their participation in the study, as well as the free labs, the free endoscopy, and the free drug.
Let's talk more about people who have Crohn's disease and what are some of the signs and symptoms and how easy is it treated, and does drugs like Stelara work?
Yes, so Crohn's disease, typical symptoms would be abdominal pain with diarrhea. Sometimes you can have constipation, but abdominal pain is the hallmark. It can lead to iron deficiency anemia. And typical drugs to treat this you see on TV all the time, such as Humira, Remicade. Stelara is one of the newer medications that are out on the market, and it's performing very well and has a lot less immune modifications. So it's really been proven to be effective in Crohn's disease. So we're studying the next generation of the Stelara-like medications, which is mirikizumab, and seeing, does that also work?
Are these drugs, you say they are effective? Are they cures? Is this something that will go away with treatment?
Yeah, Crohn's is not curable. It's a lifelong disease that relapses and remits. So it comes and it goes. So these medications help to put it in remission and help it to stay in remission. But unfortunately, at this time, there's not an actual cure.
Is there anything you can do with your diet or in your way of life to try to avoid Crohn's disease, and how do you get it?
Yeah, it is an autoimmune disease, so there is some familial predisposition to it. It can run in families. There isn't anything necessarily that has been proven you did to make yourself get Crohn's disease. Some people with Crohn's disease find that a low carbohydrate diet helps with their symptoms, but to date there hasn't been any proven dietary management that actually puts it into remission.
Dr. Jones, I think it's important that people know that if they are a patient and they are a participant in this study, they will receive free drugs and compensated for their time.
Absolutely. And, you know, some people may already have a gastroenterologist that they're working with. They don't have to lose that gastroenterologist either. This would be an adjunct to staying with their current gastroenterologist. We would communicate all of our findings and all the results to them, but be able to put them in this trial to receive these free services.
All right, Dr. Frances Jones from TPMG, thank you for joining us today on the Hampton Road Show.
Yeah, thanks for having me, Chris.
To learn more about TPMG's Crohn's disease clinical trial, you can call 757-741-0981 or email clinicaltrials@tpmgpc.com for more information. You can also visit mytpmg.com.